Hi, everyone. My name is Avi Benlolo. I'm the president and CEO of Friends of Simon Wiesenthal Center. We're a human rights organization, and it's with that we have a very distinguished panel with us today, a panel of doctors from around the community who will be talking to us today about COVID-19 and the crisis, the pandemic that is all around us. It's especially important as a human rights organization that we relay this information to you. Without further ado, I'd like to introduce the four panelists. They are Dr. Deron Brown. He's the Chief of ENT at Scarborough Health Network and Adjunct Lecturer at the University of Toronto, and also serves as a surgeon in Yellowknife, Northwest Territories. Dr. Lisa Salamon, she's an emergency physician as well as an ED pandemic planning lead at Scarborough Health Network. She also serves as a district chair for the Ontario Medical Association for District 11. We have as well Dr. Gerald Rosenstein. He's Chief of Nephrology and Director of Dialysis at Grand River Hospital, as well as Assistant Clinical Professor of Medicine at McMaster University. We have with us as well Dr. Gordon Arbess. He is staff physician in the Department of Family and Community Medicine at St. Michael's Hospital in Toronto and the Clinical Director for HIV/AIDS program at St. Michael's Family Health Team. Dr. Arbess is also on the faculty at the University of Toronto and serves as Director of the HIV Fellowship Program at the university. And Dr. Paul Prolong has been an emergency physician at Mackenzie Health for over 20 years and also serves as the medical director for the Oak Ridges Medical Urgent Care Center. In addition, he treats patients with chronic pain both in Markham and Barrie and practice emergency medicine in Bermuda. So thank you all for being with us here tonight. Thank you for your time. I know that you're all very, very busy, really doing these good deeds, making the world a better place in real time and on the front lines. So kudos to you. We really appreciate the risks that you're taking every single day. And perhaps I'll start with Lisa and ask her, about the risks that she is taking every day on the front line and what she sees and how she feels doing that, putting herself in that position.
Well, thank you very much, Avi. So, from the beginning, I felt that this is my job. This is what I've trained for the last 20 years to do. And I never looked at it as taking a risk. I felt that as long as I feel protected, I'm okay going to do my job. So the analogy I make is I really feel that this is akin to a war. And a soldier never goes into war without their armor, and I won't go and see a patient without my armor. So I make sure that I am equipped with my personal protective equipment, my proper mask, my gown, my head covering, my goggles, my face shield and everything, my gloves. And I just make sure that before I go into any situation that I'm personally protected. And for the last 6 weeks, I've made sure that everyone around me is also has the appropriate protection as well. I've advocated for the last 6-7 weeks within my hospital, within the government, within the community to ensure that everyone around me has the appropriate masks, gowns, and other protective equipment that is needed. So I feel honored and privileged to be able to do the job that I'm doing right now. It is, I can't even tell you, it's inspiring to see everyone come together and work in a collaborative and collegial way. And so I don't even think about it as risking my life. I make sure that I'm protected, and I'm happy to do so.
Thank you, Dr. Salamon, for that. We really appreciate that. And I wanted to turn it over to Dr. Rosenstein. And you've commented to me in the past that you're exhausted and that your work life has changed so much. Can you tell us about that?
Well, it's been very tiring. My work is to take care of patients, essentially to take care of patients who are on dialysis. So these are not patients who I can cancel appointments and not see for a period of time or do virtual care. They have to come in for their care and I have to see them. So most of my time is spent lobbying with and against government administration to make sure my patients are properly assessed, tested. It's been a real problem getting all of our patients swabbed. Keeping them alive. There's such a much higher incidence of COVID in chronic dialysis patients and a much higher mortality in that population. So it's keeps me awake at night. I wasn't much of a sleeper before, but now I don't sleep much at all.
Well, I bet, and I can see it because I know you for a long time. But you still look great. You look fantastic. Dr. Arbess, we've been talking now for several weeks, and really, at the outset of this, about the problem of PPEs, and you've been, and I know everybody else here on this panel has been as well, really working hard to secure PPEs for your hospital and your colleagues. And maybe you and some of the others, if you have opinion on this, you can jump in and tell us, what is the situation? Does Ontario have enough equipment to sustain itself?
Well, I think the issue is how the recommendations keep changing. From day one, we were told what we needed to do, and then the next day we were told we needed to do something different. So I think that caused a lot of anxiety amongst healthcare workers. And depending on where you were, the situation changed. So I know at our hospital initially, we were being given, each day one mask and being told, if you have a lunch break, put your mask down and then put it back on. So that caused a lot of grief and anxiety. But like Lisa was saying, the key here in doing this work is we're all happy to do the work as long as we're protected. And I know at our hospital, the communication has been very good. I work at St. Michael's Hospital, and although everything's changing, so now I got an email today saying instead of a gown that we've been throwing out, we're going to be using reusable gowns. So now I have to learn how to do that and what that means. And there's a video I need to watch now. And so all out of the blue, that just came. So the question is, who should be wearing what and when? And so we know that there's certain masks that should not be worn, an N95 mask. And sometimes when you're out on the street, you see people wearing those masks. Those things are highly coveted because they should only be used when there's a risk of aerosolized droplets. So in a procedure, for example, if someone's being intubated or in the operating room. And so it's just, everything's becoming clearer. And I think the supply chain, we hope, will be able to continue. And we hear things in the news where things are coming from China, and then they're not adequate. And so the question is, who's in charge? Should it be centrally from the federal government? Should it be the provinces? And I know in the United States you hear about this as well. But at the end of the day, if we're going to do this work, we need to have the equipment. And I know I work with a lot of.
And do you have the equipment? Do you have the equipment?
I have the equipment.
What about everybody else? Does anyone not have equipment or sufficient equipment?
So we're all hospital-based, so I assume that we all have the equipment. The issue that I've been finding, so as the chair of District 11 of the Ontario Medical Association, I represent all the physicians in Toronto. And the issues we have is that physicians in the community and in long-term care do not have the equipment. And what I did over the last 6 weeks is I started a PPE drive on my own, or with a colleague of mine, and we've literally been providing community physicians and long-term care with PPE. But there's only so much that we've been able to raise, and so far I've been able to give whoever asked. But we're running out of our, we got from donors, I got from patients of mine who have construction companies. We got from all sorts of people that are in the community. A lot of people had happened to have for various reasons based on their jobs and things like that. So my concern is, yesterday I was doing a PPE drive in York Region where I was handing out with the Ontario Medical Association to people who put in their requests through the OMA about stuff that they needed. And I can tell you, when I was speaking to them, they have nothing in their office. They're trying to open their offices and they have nothing. And I got a donation from a company, a big distillery, of 1,000 liters of hand sanitizer that I'm going to give out. And a lot of them are coming by and saying they don't even have hand sanitizer. So I'm not going to speak for everybody here. I'm assuming, given that we're hospital-based, that we have the PPE based on the hospital base, but the concern is actually the physicians in the community. And as you've heard, the long-term care has been a big problem.
Okay. Well, that's very informative. Thank you for telling me. And I know of someone who may have at least surgical masks, so we can talk afterwards. Dr. Prolong, you're in the ER at Mackenzie Health. Have you seen a slowdown in people coming into the hospital? And also, what is the situation of COVID patients at the same time?
Thanks, Avi. So definitely our volumes have come down tremendously. We were used to volumes of around 335, 345 patients per day. Those numbers went down to about 120 to about 140. Recently, in the last couple of weeks, they've come up to about 150 to 170 patients per day. So the volumes are slowly starting to come back up. But the reality is the patients that we are seeing in the emergency department are delayed presentations of bad illness. So, for example, I had last week, I had a patient who came in basically vital signs absent. He came in ventricular fibrillation. He had chest pain the night before, so he had his heart attack the night before. His daughter found him collapsed. They brought him to our ER 8 hours after he had symptoms. There's a lot of examples like that. I've seen ruptured appendix. I've seen delayed presentation of cholecystitis, so gallbladder inflammation. So people are afraid, and there's a lot of collateral damage. And truly, the emergency department is probably the safest place for these people to be. So that's the one pattern that I have noticed. So volumes have come down tremendously.
And I bet you that once this is over, hopefully soon, the volumes will come sharply up with people who needed care and were delaying. And
so I'll be honest with you, I'm not so sure. I lived through SARS in 2003, and basically our hospital, us and Scarborough Grace, we were the two hospitals, and obviously North York was affected, the downtown hospitals, but really our hospital and the Scarborough hospital, they took a big brunt of it. And I'll be honest, it probably took about 2 years until our volumes were restored. So I don't think this is something that, I don't believe volume is going to come back all that quickly. People are still scared. There's when you look at emergency medicine, there's a lot of people that present, they're anxious, they're scared, but they know that there's nothing wrong with them. There's a lot of people there's a lot of anxious people that know that they're fine. Those people, I expect to see those people in a couple of years, not sooner.
Okay, fair enough.
We have a social media campaign at our hospital trying to get people to come to the emergency room, saying, please come, it's safe, you'll get good care, and make sure you get looked after. So that's how far we've come, is that we have a social media campaign to get people to come to the hospital.
We started a virtual emergency department. So patients call in with their emergency complaints, and they're dealt with over the phone by an emerge doctor. And in a small percentage of times, patients are urged to come to be seen. And it's been very successful.
That's wonderful.
That's a concern everywhere. People are afraid to go to the emerge. They don't want to get COVID-19.
Yeah. So I wanted to ask several other questions. Dr. Brown, what are your thoughts? What will happen? What will need to happen for things to resume to be back to normal? For example, testing, antibody testing, a vaccine. Do you have particular thoughts in that area?
Well, I think we have to accept the fact that we're not going to return to normal, that the way things had been is over. We see that already in grocery stores with the plexiglass, and healthcare is no exception. I can tell you in my own office, changes are being made in terms of how we schedule patients. There's not going to be busy, full waiting rooms anymore. Not only because it isn't safe, but it speaks to the fear that people have. I still have an office outside the hospital, and I'm as busy as my patients let me. Many are scared to come even to my office. So we're going to have to change the way we see patients in the office. In my specialty, you talk about aerosolizing procedures. Everything that I do is aerosolizing, essentially. Working in the mouth and the nose, in the office, in the operating room. And we're now going to have to take specific measures to control that environment. So there's going to have to be time now between patients being seen in the exam rooms. We're looking at using UVC light to decontaminate the air in the examination rooms and in the operating rooms. We're looking at ultrafiltration and suction devices to be used in the operating rooms to clear the air, and then leaving a period of time in between cases for the air to be purified before we bring in the next patient. That's going to have significant impact on the volume of cases we're able to do. It's going to have significant impact on the cost of care delivery. So no, we're not going to go back to normal. It's going to be akin to HIV, having universal precautions, having the special needle caps to prevent accidental pin pokes. We're not going back to normal. And as far as vaccine, as far as antibody testing, those aren't around the corner. I think a lot of resources are being used to develop this, but
So
I'm not so optimistic.
The average layperson like myself, obviously, you know, we are shut in our homes. We're working at home mainly, and we want to know from the medical community, what does this look like? What can we expect? When are we going back to work? What is, you know, or is this our new reality? What can you tell us? Anybody?
I can tell you nothing's going to happen until we're ensured the safety of the public is guaranteed to the best of our ability. That's the take-home message. I think everybody sitting at home should be aware that we're not doing this because we want to.
No vaccine, but if there's no vaccine, we can't keep society shut. So, you know, we're going to have other problems as well.
Well, I think a good place to start is people who can work from home will remain working from home. And we realize now that probably a lot of people, you know, lawyers, physicians, even through telemedicine, other office workers can really be working at home. And that's what you'll find, even not only months from now, but probably years from now, you'll see more and more people working from home.
My husband,
Things aren't going to return to normal until there's a vaccine. You know, there's treatments that are being developed, antiviral treatments that are reserved for the sickest of the sick. But this is a condition where it's highly contagious, and there's a small but significant fragment of the population that are extremely vulnerable, extremely at risk, and there's a high mortality. Herd immunity doesn't work with this kind of condition.
So what about, this clearly does not affect young kids as much, okay, as much.
No, but we're seeing it in younger adults.
Will students be able to go back to school?
so the issue is that kids, while they're not, that's actually a bigger problem, and there's some studies going on right now about it. It looks like, and there's conflicting results, but it looks like that kids are asymptomatic carriers, meaning they have COVID, but they don't show symptoms. So the concern is if they go back to school, they spread it amongst each other. No one knows they have it, and they spread it to like their bubbies and zadies, their parents, their relatives with, with immunocompromised issues. And that's scary. And I've seen it personally myself in testing. You know, I work in the COVID assessment center. I've seen asymptomatic children who are positive, whose parents have it. And so there are currently studies going on at Sick Kids. I'm trying to get involved in one and myself to try to test some of these asymptomatic kids and see what the incidence is. So until we actually have some studies on it, we can't send the kids back to school because there's huge repercussions. And remember, the kids, if they go back to school, someone has to teach them, and the teachers are adults. So, you know, it's a big problem. In terms of working, my husband is a business person. He works in telecom, and he says that there's way more efficiency now with people working from home. So I actually think for a lot of people, it's going to be the new normal.
Yeah, well, look, I mean, I agree, and it's hard for me to hear because, you know, with our organization, everything is about social engagement in the classroom, at events and programs. So this is going to be very challenging for us and for, you know, I guess others like us. But it is the new reality. Let me ask you another question. So you are all on the front line. You know, you're seeing a lot of things that the average person is not seeing. We're hearing about it in the media, and we're seeing the very sad stories, and truly sad. Is this true? What we're seeing in the media, is this very accurate and reflected? And we should.
Yeah, I mean, it is accurate for sure. I mean, not the same situations that you see in the U.S. and in Italy and in Spain and, you know, the U.K. You know, we're not seeing those kinds of volumes because we kind of knew how to react early. We were prepared. We were prepared after what we saw was going on in these other places. Back to the point of Dr. Rosenstein, I'm not sure that herd immunity doesn't exist necessarily. I don't think we have proof that it doesn't exist. You know, like the problem is we don't know much about these antibody tests, whether if you do have the antibodies that this thing will never come back, or, you know, because other viruses basically, you know, if you've developed antibodies, there's a good chance you'll probably be able to clear it and have some immunity. So we're not 100% sure. There needs to be further research. All of this stuff takes time. You know, we'll have to see what happens in Quebec if they truly open. You know, they're talking about opening the elementary schools now, and I mean, there's an important social aspect here with what happens. You know, like kids need to be with other kids. It's important. It's tough for them not to. I mean, you know, I'm sure Dr. Salamon is gonna tell you that we're seeing some other stuff that we're not used to seeing. You know, from people being cooped up, they don't get along well with their partner or with their kids, and kids need to be able to leave the house also. You know, some kids are not in a very safe situation or a very good situation at home. So, you know, home is not necessarily the best place for them. You know,
right. Which is what I was saying earlier. And there's different, someone I think was pointing out there's different mutations of the virus already.
Possibly. But we're seeing a lot more psychiatric stuff. We're seeing more substance abuse, suicide attempts, overdoses. You know, people are doing things that, you know, in larger amounts because they're stuck at home. They don't know how to, you know, channel their energy.
Right.
You know, in the two hospitals I work at, we have over 60 patients admitted with COVID-19, and probably about a dozen in each hospital intubated. And I've done this for over 30 years, and I've seen a lot of really sick patients. These are amongst the sickest patients I've seen, and they present some of the most unique challenges of any sick patients I've ever seen. And that you asked the question, Avi, why am I so tired? This is what keeps me up at night. It's just heartbreaking to see patients.
And it's hard. I mean, you got to take care of yourself, because we've heard some sad stories about health.
And then when these patients are alone at the time of their death because their families aren't allowed to be with them, it's just tragic.
Absolutely. I want to ask, I know we're running out of time, and I have so many questions, and it's more than probably I can do. Did we fail the senior citizens of our communities? Did we fail them?
And we're continuing to fail them by not having universal testing of all of the long-term care patients. This has been a battle I've been in for several weeks now with the province, with my hospital, with infection control. We're not swabbing enough patients, and long-term care is just
we also have major staffing issues in these facilities, right? Where we're asking people to work in a high-risk setting and pay them very minimally. And so people were either getting sick or getting tired or saying, I can't do this anymore. And now, you know, all the hospitals are scrambling to provide support to these long-term care facilities. It's a mess. It's a real mess.
So I saw it at the end of March. So out in Scarborough, where Deron and I work, we got hit the first. So Scarborough and Durham were the first big. We got the big surge initially, and March 20th was the date that I emailed about long-term care, and we saw we were having outbreaks in long-term care. We saw what was happening. We were basically, you know, trying to advocate for universal swabbing, and, you know, we had issues with public health. I mean, I think everyone on this table can say public health, IPAC. A lot of people were, it was basically trying to, you know, climb up a mountain with red tape and stuff. And, you know, I could say, look back, I know March 20th was my first email about it and what we had to do. And truthfully, like, you know, it's not us as physicians that we're failing the elderly, it's the government. And I will put my, you know, I've gone on social media and I have blamed Doug Ford for this and his government. You know, he did not make good policy, good decisions. I can tell you myself personally, did lobby him. I had a meeting with the chief of staff before they shut down the province. I begged him to shut down the province. I begged him to release their expired PPE. I begged them to make a mandatory 14-day quarantine for healthcare providers returning from travel. And he did, it took a while after my meeting with him for it to do that. And I feel, I know that the Ontario Medical Association did a lot of lobbying, and a lot of the good policy work came from their lobbying, but it was a lot of hard work. It looks like now perhaps he's listening to the right people, but the problem is, and he's shown this time and time again throughout his reign, and I don't mean to make this political at all, so I'm sorry if I am, but you're asking who's to blame. And I think that he was listening to the wrong people initially, and now it's looking like he's finally listening to the right people because he's finally making the right decisions. So I'm happy with the decisions he's making now, but if you ask about the beginning, it was a big problem.
Yeah, and I think there was a lot of learning in the beginning, probably for a lot of people.
The problem is, Avi, we knew what the right answer was. We knew from South Korea they were testing everyone, and what Lisa's saying, we've only started doing this past week, going into the nursing homes. This should have been done 3 weeks ago.
Right.
So March 20th, a month ago.
We knew what we needed to do. We were rationing tests. I mean, that's
still have the lowest testing rates in Canada.
But even as of today, because it's a big problem for dialysis patients, we have a lot of patients in long-term care. And in my community, one long-term care facility had 140 patients who had COVID-19. And we've been lobbying. And even now, even today, the edict is only if they're symptomatic. But elderly patients often have atypical symptoms. Many times they don't have symptoms. They may not manifest a fever. They may just be dizzy or feel weak. So we want universal swabbing, but it still is a constant battle with infection control around the province.
There's also a problem with telehealth. Ontario, I've had patients, one of the odd symptoms is loss of smell and taste. And I've had patients, I've instructed them to call telehealth and get to a COVID testing center. And up until recently, they were being told not to go, that it's not necessary. There's a lot more cases that are out there that we just have not picked up.
Yeah, I agree. And that seems to be a big problem. I want to ask you two last questions. The first one is, what is the average citizen, what can the average citizen do to help you and to support you and all healthcare workers? What can we do? Because we feel that we can't do a lot. So maybe you've got some ideas.
Wash your hands until they're raw.
We're washing our hands. We're keeping separated.
You know what, Avi, with the weather getting nice this coming weekend, people are going to be tempted to say, I got to get out of my house. I got to leave my family, go on a jog or a trail or to the park. And really, I encourage people to sort of hang out in their backyard or their front yard. But really, it's imperative that people generally stay home unless it's absolutely essential to leave. And I know people are going to get tired of that message. And I know people have spoken to me saying, I don't know how much longer I can do this for. But I like Lisa's shirt.
Oh, look at the shirt. We stay at work for you. You stay home for us. Oh.
Avi, it's important to remember history. You're in an organization that cherishes history. The Spanish flu, there was the so-called second wave. We have to be wary of the second wave because there will be a second wave. And the second wave of Spanish flu killed more people than the first wave. Uh-huh. And none of us want to be in a situation where we've suffered for over 6 weeks. We're going to prematurely open, like Quebec is doing, I might add, and then brace ourselves. And it wouldn't be a shame if we now have this second wave and we have to go back into lockdown. That would be horrendous, catastrophic, but it's a reality.
You know what I want to say, just on a positive note, what I've seen is, you're talking about staying home, but what you asked the question, what can they do for us? And I have to say the generosity and the humanity that have been shown by people in the community. Deron and I work in Scarborough, which is an immigrant community, and just, them coming and saying thank you and giving thank you cards and giving little gifts and sending food and all that kind of, obviously packaged separately, like not communal food, but all those little things, they may seem like little things, even like Starbucks giving free coffee, all those things, it just kind of fills your soul, having the parades and the front, the first responders. Today, there was like a postal worker, they drove around the hospital. All those things actually, what we see, it's dark, right? We see a lot of, we saw a lot of illness, a lot of morbidity and a lot of mortality and a lot of death. And it's really hard. And, we want, as physicians and as frontline workers, we want to come out on the other side and be okay. And when
Yes.
people show their appreciation, when people give you a little bit, people
Yeah.
want to show your support. For me, that helps fill my soul, and that means a lot to me.
Yes. And I have to say that I've seen that, and you know, there's a lot of acts of kindness in the community and in society, and I think it's uplifting. For me, it's very uplifting to just watch and observe what people are doing, and you know, in some cases take part, but just helping wherever you can. It's nice. It's nice to see. I'm a big fan of all of you, and really our health community. I've been following your work, as you know, and we're here. We're here for you. If there's anything that you need, please call me or the organization. I want to thank you for the insight and the input. We're going to be putting this online for the rest of our community to listen to your thoughts and ideas, and maybe we can do it again some other time.
Sure.
Sure, great.
Thank you.
Thank you, Avi.
Thank you very much.
Thank you.
Thanks, everyone.
everyone.
All right.
Bye.